Yeah, so we're presenting results from a retrospective study looking at our center patients with advanced HCC who were treated with Atezo-Bev with or without the addition of stereotactic body radiotherapy or SBRT. By way of background, there isn't a whole lot of published data on the use of SBRT with the combination of Atezo-Bev and advanced HCC. And so we're hoping our study provides some preliminary evidence which can be used for the design of clinical trials going forward and for other prospective studies. The current standard of care for advanced HCC is Atezolizumab and Bevacizumab. Patients who progress on this regimen, there is not a whole lot of very robust data for what to do in the second line. And so maximizing responses and time on first-line therapy is of critical importance for these patients, as basically when they progress, they have lower likelihood of responses to second-line therapy and are at higher risk for shortened survival. There is one published study, I believe it was out of MD Anderson, that came out late last year. It was an uncontrolled study where they looked at patients who also got radiation with Atezolizumab and Bevacizumab. There was some reassuring safety data that came out of that, which we will also see in our poster today. However, the magnitude of benefit from the addition of SBRT in that study isn't clear because it was uncontrolled. There isn't. We do need more evaluations and more studies on identifying patients who are at risk for radiation-induced liver disease. In our population, we had 15 patients who received Atezolizumab and Bevacizumab with SBRT, and of those, 3 had suspected radiation-induced liver disease. Within the context of our methods, because it was a retrospective study, we are left with suspected RILD as opposed to proven RILD. Identifying patients who are at risk will be of critical importance as we move to use radiation in this setting. So we actually have an ongoing phase 1 trial that will formally assess in a prospective manner the combination of SBRT at either 1, 2, or 3 doses in combination with Atezo-Bev. We presented the trial design last year at ASCO GI 2023 as a trial in progress report, and we're hopeful to have the data finalized potentially for next year's ASCO GI.